Dementia affects millions of people, and nurses are on the front line of that care. On clinical rotations, nursing students are often thrown into situations with confused, scared, or even agitated patients who may not understand where they are or what is happening. If these interactions are handled poorly, stress can escalate quickly, both for the patient and for the student. Yet, most nursing programs rely on short role plays or a few traditional simulations that are hard to scale and rarely capture the emotional intensity of real dementia care. We set out to build a training tool that lets nursing students safely practice dementia-specific communication, empathy, and de-escalation before they enter the real hospital environment. Introducing the KindMind MR, a mixed reality training system designed specifically to prepare nursing students for dementia care at the bedside. The KindMind MR system combines two components centered around the nursing student's experience. First, a physical patient prototype with a head and neck that move, grounding the student in a realistic bedside setup. Second, a Unity-based mixed reality layer anchored to the room with QR codes that overlays a virtual patient living with dementia. Together, the physical mannequin and virtual patient create an emotionally responsive dementia care scenario where nursing students can practice what to say it, and how to read the patient's reactions in real time. To build a physical component, we started with a nursing mannequin and integrated a servo motor to rotate the head and a linear actuator to simulate swallowing. These motors are controlled by an Arduino and a Wi-Fi-enabled microcontroller that receive commands from the MR simulation. When the virtual patient becomes more stressed or agitated, the mannequin shows corresponding behaviors: sharp head turns, restlessness, or reduced motion when the student successfully calms them. This links the emotional state of a person with dementia to realistic physical cues that nursing students must notice and respond to. In the mixed reality interface, nursing students see an overlay around the mannequin, a vitals panel, a dementia-specific stress bar, and branching communication options. A scenario might begin with a patient repeatedly asking to go home or refusing a routine intervention because they're afraid. Each dialogue choice represents a different communication strategy: correcting the patient, redirecting them, or using validation and reassurance. Every decision updates the patient's stress level and body language, and those changes are mirrored by the mannequin's movements. Students immediately see how their words and tone impact a patient living with dementia. A typical training session starts with a brief handoff that outlines the patient's dementia history and current clinical status. The nursing student enters the room, orients to the mannequin, and then begins the mixed reality guided interaction. They must interpret both clinical data and behavioral cues, like rising stress, confusion, or withdrawal, and choose how to respond. The system logs each choice and updates the patient's emotional state in real time. After the scenario, students receive feedback on which responses escalated or de-escalated the situation and can reflect on alternative approaches to improve their dementia communication skills. The KindMind MR platform gives nursing programs a consistent, repeatable dementia care scenario that can be used across multiple cohorts and skill levels. By blending physical realism with mixed reality, it offers nursing students a safe environment to build confidence, empathy, and de-escalation skills before they step onto the clinical floor. Thank you for watching. We are the KindMind MR team, working to better prepare nursing students for dementia care in the real world.